Hi guys, today we're going to see a video on local anesthetic agents. In this video we're going to discuss about the pulpal and soft tissue duration of each drug, which local anesthetic agent should I give while doing our implant surgery, why doesn't your local anesthetic agents work on an infected site, and is there a special local anesthetic agent that I can give on an infected site. So welcome to Dr. Febel Huda's Dental Encyclopedia. So what is an local anesthetic agent? It is a drug that causes reversible loss of sensation to a particular site without loss of consciousness. There are two types of anesthetic agents. One is esters and then amides. Esters are no longer being used in dentistry except for benzocaine, which is used as a topical anesthetic. So we're going to discuss more on amides, and I'm going to put only the ones which are commonly used by us. So the first drug which we're going to discuss here is the most commonly used drug called Lidocaine or Lignocaine, and we are going to see what is the pulpal duration of this drug. The pulpal duration of Lidocaine is about 60 minutes, and then you have a soft tissue duration of 180 to 300 minutes, and the maximum cartridges that we can consume without reaching the toxicity level on a 70 kg person is about 11 cartridges. The advantage of lidocaine is it's safe on pregnant as well as lactating women, and it is less expensive drug. The second drug which we are going to see here is Mepivicaine. The pulpal duration of Mepivicaine differs from infiltration to block. In infiltration, it lasts for 20 minutes. In block, it lasts for 40 minutes. The soft tissue duration is from 60 to 120 minutes. The maximum cartridges that we can consume on a 70 kg person is about 7.5 cartridges. The advantage of Mepivicaine is that it is safe on a cardiac patient, and it is a very short acting local anesthetic agent. The third drug which we are going to see here is Articaine. The Articaine has a pulpal duration of 60 to 75 minutes and a soft tissue duration of 180 to 300 minutes. The maximum cartridges which we can consume on a 70 kg person is about 7 cartridges. The advantage of Articaine is it has a very good diffusion in bone as well as soft tissue. This is also a drug of choice when it comes to a cardiac patient. The last drug which we are going to see here is Bupivicaine. Bupivicaine has a pulpal duration of more than 90 minutes and a soft tissue duration of 240 to 720 minutes. The maximum cartridges that we can consume on a 70 kg person is about 10 cartridges. The advantage of this drug is it is the long acting drug, the anesthesia that has the longest anesthetic option. Now you can see that there are a lot of color codings in these cartridges. They have specific information of what anesthetic agent it contains and the amount of epinephrine or vasoconstrictor that it has. Now what of vasoconstrictors? Now we have to have a safety measures on the vasoconstrictors as well. Now epinephrine 1:50,000 is safe for a 70 kg person, of healthy 70 kg person. You can administer about 5.5 cartridges, whereas the same weight person who is a cardiac patient, you're supposed to completely avoid them. Now epinephrine of 1:100,000, if your patient is healthy and a 70 kg, you can give up to 11 cartridges, and a 70 kg cardiac patient, you can give only 2 cartridges. Now what happens if epinephrine is 1:200,000? Now in 1:200,000, on a 70 kg healthy patient, you can administer about 11 cartridges. On a 70 kg cardiac patient, you can administer only 4 cartridges. Now coming to levonortifine, you have about 1:20,000. You can administer about 11 cartridges on a healthy 70 kg patient and only 2 cartridges on a 70 kg cardiac patient. Now we have to come to the most interesting part of this presentation, which is which local anesthetic would I use when I'm doing an implant surgery. So if my procedure is a short procedure, I would stick on to a lidocaine or a lignocaine. If my procedure is a long procedure where I have to do a patient on a sinus lift or a full mouth case, then I would prefer to go for a Bupivicaine because it is a long acting and local anesthetic agent. Now, whether I would give an infiltration or a block, if it's a small procedure, infiltration is more than enough. But if it's a long procedure or a sinus lift or any other procedure that's going to take a lot more time, I would prefer to go for a block. Now we have to understand what happens when a local anesthetic agent is applied onto an infected site. Why doesn't it work? There are three reasons that are given in journals that will cause a loss of sensation or the local anesthetic to not work in an infected site. The first one is, since the infected site is more on a low pH, your ions from your anesthesia is not able to cross the cell membrane and into the cytoplasm to stop or block the sodium channel. The second reason here is that increased blood flow to the infected site so that your local anesthetic agent is constantly getting removed off. The third reason here is the inflammatory exudate itself. The exudate inhibits your anesthetic agents from infiltrating into the sodium channel. Now, is there a specific drug of choice that I can give on an infected site? The drug of choice for an infected site is Mepivicaine because it has an ability to cross over an acidic medium and give you an anesthesis on that particular region. The other techniques that you can do other than doing an infiltration or a block is a periodontal ligament injection or an interseptal injection. The only thing that you have to keep in mind here is, once you have done an infiltration on an infected site and come to know that the site is not getting anesthetized, do not use the same needle to give a block or a periodontal ligament injection or an interseptal injection, because you're gonna seed this infected cells into a new site. So it's better you change the needle. If you need any videos on how to administer an interseptal injection, please do post them in the comments below so that I would make a specific video on how to give or administer an interseptal injection. So these are my references for this video, and if you have any doubts, please feel free to comment in the comment section so that I would be able to help you out in learning the subject much more better. So see you in the next video. Till then, this is Dr. Febble signing off.